Alert! Statins, serious side effects you should know. Have you ever wondered if you are putting your health at risk by taking medication to control your cholesterol? Are the side effects of these drugs more serious than we imagine? What if it was possible to avoid complications and still protect your body? Statins, such as ATORVASTATIN, rosuvastatin, and simvastatin, are widely prescribed to reduce levels of LDL cholesterol, known as bad cholesterol. They have been protagonists of many medical discussions, generating both support and distrust. While the benefits of statins in preventing cardiovascular disease are undeniable, some people report negative experiences, including muscle pain, liver problems, and even more serious complications. But are these reactions common or just myths amplified by misinformation? In this content, you will discover the truth behind statins, understand how they work, what their side effects are, and most importantly, how to use them safely and effectively. Let's get started. What causes the side effects of statins? Statins work by blocking the enzyme HMG-CoA reductase, which is essential for the production of cholesterol in the liver. By inhibiting this enzyme, there is a reduction in LDL cholesterol levels, the main responsible for the formation of fatty plaques in the arteries. Although this mechanism is effective in preventing heart attacks and strokes, it can also trigger unwanted effects in some people. The side effects of statins are mainly related to their interference with cellular metabolism. By blocking cholesterol production, statins can also affect other biological processes dependent on this molecule, such as the production of coenzyme Q10, a compound essential for cellular energy and muscle health. The reduction of this coenzyme can explain symptoms such as muscle pain and fatigue. Furthermore, the impact of statins on the liver also deserves attention. Because they are metabolized in this organ, they can increase levels of certain liver enzymes, a sign that the liver is being overloaded. However, this change is generally mild and reversible with adjustment or discontinuation of the medication. Another factor that may contribute to side effects is the interaction of statins with other medications or foods. For example, consumption of grapefruit juice is known to enhance the effects of statins, increasing the risk of complications. More serious side effects, such as rhabdomyolysis, severe muscle destruction, and liver failure, are extremely rare but can occur. These conditions often affect people with pre-existing risk factors, such as metabolic disease, kidney problems, or concomitant use of medications that increase statin toxicity. Despite these risks, most people who take statins do not experience significant side effects. This reinforces the importance of a careful medical evaluation before starting treatment, considering the benefits and possible risks in each case. Is it possible to avoid the risks associated with these medicines? The good news is that with simple measures, many of the risks associated with statins can be avoided or minimized. The first and most important strategy is regular medical monitoring. Before prescribing statins, your doctor will usually order tests to assess liver function and other health markers, such as lipid profile and blood glucose levels. These tests allow you to identify pre-existing conditions that could increase the chance of adverse effects. Another way to reduce the risks is to adjust the dose. Lower doses of statins may be sufficient to achieve treatment goals in many cases, decreasing the chances of side effects. If the minimum recommended dose is not effective, the doctor may choose to change the type of statin or combine it with other medications, such as ezetimibe, for better cholesterol control. Diet care also plays a fundamental role. Avoiding foods that interact with statins, such as grapefruit juice, is essential to avoid complications. Furthermore, a diet rich in fruits, vegetables, whole grains, and healthy fats can enhance the effects of the medication and reduce cholesterol levels naturally. Another important point is the early identification of possible symptoms of side effects. If you notice signs such as persistent muscle pain, weakness, dark urine, or extreme fatigue, it is essential to see a doctor immediately. These symptoms may indicate problems such as rhabdomyolysis or liver overload, which, although rare, require attention. Furthermore, choosing the right statin can make a difference. Some people tolerate certain formulations better, such as pitavastatin or pravastatin, which have less potential for drug interactions and side effects. This individualization of treatment is essential to ensure safety and effectiveness. Finally, maintaining a moderate physical exercise routine and a healthy lifestyle contributes significantly to overall health. This not only improves the effectiveness of the medicine, but also reduces the need for high doses, further reducing the risk of adverse effects. With these measures, it is possible to use statins safely and reap the benefits they offer in preventing cardiovascular diseases. What are the consequences of not treating high cholesterol correctly? High cholesterol, especially LDL levels, is one of the main risk factors for cardiovascular disease. Without adequate treatment, the consequences can be devastating for your health. High cholesterol can lead to the buildup of fatty plaques on artery walls, a process known as atherosclerosis. Over time, atherosclerosis can cause narrowing or blockage of arteries, reducing blood flow to vital organs. This condition is the main cause of myocardial infarctions, strokes, and peripheral arterial disease. These complications can appear suddenly and in many cases be fatal. In addition to the risk of acute events, such as heart attacks and strokes, untreated cholesterol can also harm quality of life in the long term. Atherosclerosis can compromise blood circulation in the extremities, causing pain and difficulty walking. This condition, called intermittent claudication, can develop into serious problems, such as amputations in extreme cases. Another impact of high cholesterol is an increased risk of kidney failure. This occurs when blood flow to the kidneys is compromised, impairing adequate blood filtration and leading to progressive loss of kidney function. Lack of adequate treatment can also worsen other health conditions such as high blood pressure and diabetes. These diseases often coexist with high cholesterol levels and together exponentially increase the risk of cardiovascular complications. It is important to note that although lifestyle changes such as diet and exercise are essential, they may not be sufficient for people at high cardiovascular risk. In these cases, the use of medications such as statins is necessary to achieve safe LDL cholesterol levels and prevent serious complications. Ignoring treatment or delaying seeking medical advice can lead to irreversible damage and limit the therapeutic options available. Therefore, it is crucial to address high cholesterol seriously, combining healthy habits and medical interventions when necessary. Treating cholesterol appropriately is one of the most effective strategies for preserving heart health and ensuring a long, active life. How to protect your body from the adverse effects of statins. The use of statins can be highly beneficial in preventing cardiovascular disease, but concerns about their possible adverse effects are valid. Protecting the body against these reactions involves a combination of medical care, lifestyle adjustments, and informed choices. The first step is to have regular exams before and during statin use. Blood tests help monitor liver function, cholesterol levels, and possible signs of muscle damage, such as an increase in specific enzymes. With this data, the doctor can adjust the dose or, if necessary, change the medication to a more suitable alternative. Another important point is to keep the body well hydrated. Adequate hydration helps eliminate toxic substances through the liver and kidneys, reducing the risk of overload in these organs. Additionally, including antioxidant-rich foods in your diet can help reduce oxidative stress, a factor associated with statin side effects. Coenzyme Q10 supplementation is another frequently recommended strategy. This substance, which plays a vital role in cellular energy production, can be reduced by the use of statins. By replenishing coenzyme Q10 levels, it is possible to alleviate symptoms such as fatigue and muscle pain. The choice of statin also makes a difference. Some types, such as pravastatin and fluvastatin, are less likely to cause drug interactions or serious side effects. Therefore, it is essential to discuss with your doctor which formulation is most suitable for your health profile. Avoiding interactions with food is also crucial. Grapefruit juice, for example, should be excluded from the diet as it can increase statin levels in the blood, increasing the risk of adverse effects. Likewise, the concomitant use of other medications must be communicated to the doctor to avoid dangerous interactions. Finally, adopting a healthy lifestyle is one of the best ways to maximize the benefits of statins and minimize the risks. Exercising regularly, maintaining a balanced diet, and avoiding excessive alcohol consumption are habits that complement treatment and protect overall health. With these precautions, it is possible to obtain the full benefits of statins while reducing the risk of side effects, promoting a safer and more effective approach to cholesterol control. Statins. What doctors don't tell you about these drugs. Statins are, without a doubt, one of the most prescribed medications in the world to combat high cholesterol. They play a fundamental role in preventing cardiovascular diseases such as heart attack and stroke. However, patients are often unaware of important information about how these drugs work and why they are so widely recommended. What few know is that LDL cholesterol, known as bad cholesterol, is not the only target of statins. In addition to lowering LDL, these medications also have the ability to decrease inflammation in blood vessels. This anti-inflammatory effect helps to stabilize fatty plaques in the arteries, preventing them from rupturing and forming clots, which are the main causes of heart attacks and strokes. Another point little discussed is that statins have effects beyond controlling cholesterol. Recent studies show that they can reduce the risk of complications in patients with chronic inflammatory diseases, such as rheumatoid arthritis and lupus. Furthermore, there is evidence that statins may have a neuroprotective role in certain conditions, reducing the risk of dementia in some patients. On the other hand, it is important to recognize that, like any medication, statins are not without risks. Adverse effects, such as muscle pain and liver problems, may occur in a small portion of the population. What many do not realize is that these effects can be controlled by adjusting the dose, changing the type of statin, or in rare cases, stopping treatment. Doctors also rarely discuss the importance of balancing benefits and risks. The decision to use statins is not based solely on cholesterol numbers, but rather on individual cardiovascular risk. For people at low or moderate risk, lifestyle changes, such as healthy eating and exercise, may be enough to control cholesterol. On the other hand, in high-risk patients, statins are essential and can significantly reduce the chance of a serious cardiovascular event. Transparency between doctors and patients is essential. By clarifying how statins work, what their benefits are, and how side effects can be managed, healthcare professionals enable patients to make more informed decisions about their treatment. Understanding statins goes far beyond numbers or myths. It involves assessing risks and benefits on an individual basis, ensuring a safe and personalized approach to protecting cardiovascular health. Side effects that can change your life. Side effects of statins are one of the main reasons many patients distrust these medications or discontinue their use. Although they are considered safe and effective by science, it is true that some people can experience adverse reactions that significantly affect their quality of life. One of the most reported effects is myalgia, that is, muscle pain. Many people who take statins describe lower limb pain, cramping, weakness, or a feeling of stiffness. These symptoms are usually mild, but in rare cases they can develop into a more serious condition called rhabdomyolysis. In rhabdomyolysis, muscle fibers are destroyed, releasing substances into the bloodstream that can harm the kidneys and lead to kidney failure. Fortunately, this complication occurs in only 0.1% of patients. Another relevant side effect is the increased risk of type 2 diabetes. Studies show that statins can, in fact, cause insulin resistance, making it difficult for cells to absorb sugar. This risk, however, mainly affects people who are already predisposed to diabetes, such as obese, hypertensive, or pre-diabetic people. Even so, the increase in risk is considered small compared to the cardiovascular benefits provided by the medication. Effects on the liver also concern many patients. Statins are metabolized in the liver and can elevate liver enzymes, which is a sign of organ overload. However, these changes are generally transient and mild, affecting only about 1% of patients. Cases of severe liver failure are extremely rare, especially when doctors monitor liver function with periodic tests. Additionally, there are reports of symptoms such as fatigue, gastrointestinal discomfort, insomnia, and headaches. Studies show that in many cases, these symptoms can be attributed to the nocebo effect, that is, the patient believes that they will have side effects and ends up noticing symptoms even when taking a placebo. Given these effects, it is essential to understand that not all adverse reactions are serious or permanent. With adequate medical monitoring, dose adjustments or medication changes, it is possible to minimize these symptoms and continue treatment without major difficulties. The benefits of statins, especially for people at high cardiovascular risk, outweigh the risks. The key is balance, identifying adverse effects early, controlling them, and ensuring that the patient has access to treatment without compromising their quality of life. Muscle pain, the sign you cannot ignore. Muscle pain is, without a doubt, the best-known side effect of statins and one of the main causes for stopping treatment. Many people report discomfort, cramps, stiffness, or a feeling of muscle fatigue, especially in the lower limbs. This symptom may appear days, weeks, or even months after starting to use the medication, varying from person to person. But what causes these pains? Statins affect the production of coenzyme Q10, a substance essential for energy production in muscle cells. With a decrease in coenzyme Q10, muscles may have difficulty performing their functions properly, resulting in pain or weakness. In addition, there are other factors that increase the likelihood of muscle pain in those taking statins. Advanced age, excessive physical activity without adequate rest, use of concomitant medications that interfere with statin metabolism, such as antibiotics or antifungals, history of previous muscular or metabolic diseases. Although common, muscle pain is generally mild and does not cause permanent damage. However, in rare cases, a condition called rhabdomyolysis may occur, in which there is intense destruction of muscle fibers. This destruction releases proteins into the bloodstream that, when reaching the kidneys, can cause severe kidney failure. Symptoms of rhabdomyolysis include severe muscle pain, generalized weakness, and dark urine. Although serious, this complication occurs in less than 0.1% of patients taking statins. If you notice persistent pain or more intense symptoms, it is essential to see your doctor immediately. Most of the time, the professional will be able to adjust the dose of the medication or change the statin to another option. Some statins, such as pravastatin and fluvastatin, tend to cause fewer muscular effects, being an alternative for those with intolerance to other types. Another approach that has shown good results is coenzyme Q10 supplementation, which helps to replace levels lost due to medication use. Furthermore, strategies such as spacing the dose, using statins every other day, or combining other medications can significantly reduce muscle symptoms. It is important to remember that muscle pain should not be a reason to abandon treatment without medical advice. The benefits of statins, such as preventing heart attacks and strokes, far outweigh this side effect as long as they are monitored and treated correctly. Regular medical monitoring, associated with a healthy lifestyle, is the key to dealing with muscle pain and ensuring successful treatment. Risk of diabetes. Are you exposing yourself too much? One of the most discussed side effects of statins is the possible increased risk of type 2 diabetes. This concern has gained strength due to studies showing a relationship between long-term use of statins and insulin resistance, which is one of the main factors in the development of diabetes. But how does this happen? Statins can interfere with blood sugar metabolism. They reduce the sensitivity of cells to insulin, the hormone responsible for transporting glucose from the blood into cells, where it will be used as energy. This process causes blood sugar levels to remain high, increasing the risk of diabetes over time. However, it is important to understand that the increase in this risk is considered low in the vast majority of people. Studies indicate that statins can increase the chances of diabetes by around 9 to 12%, especially in individuals with a prior predisposition, such as those with obesity, a family history, or high blood glucose. People who already have prediabetes are the most susceptible to this adverse effect. Still, statin use should not be discontinued based on this risk alone. This is because the cardiovascular benefits of statins significantly outweigh the additional risk of diabetes. For example, in patients at high risk of heart disease, the use of statins can reduce the chances of heart attack or stroke by up to 40%, a value much more impactful than the relative risk of developing diabetes. To minimize this possibility, some strategies can be adopted. Constant monitoring. Fasting blood glucose and glycated hemoglobin tests must be carried out regularly to identify any changes in blood sugar levels. Healthy lifestyle, regular physical activity and a balanced diet help keep sugar levels under control and reduce the risk of diabetes. Use of specific statins. Some formulations, such as pravastatin and pitavastatin, have less impact on sugar metabolism and may be indicated for patients with a greater predisposition to diabetes. Furthermore, it is worth remembering that in many cases, the increased risk of diabetes occurs in conjunction with other factors, such as advanced age and a sedentary lifestyle. In other words, the use of statins may be just an additional factor in a more complex health situation. Therefore, the decision to use statins must be made based on a detailed assessment of the patient's cardiovascular risk. In individuals at high risk of heart attack or stroke, the benefits of treatment are unquestionable and outweigh any small increase in the risk of diabetes. Maintaining medical monitoring, undergoing periodic exams, and adopting a healthy lifestyle are essential steps to protect your health, ensuring that the use of statins brings the best possible results without compromising general well-being. Liver at risk, the hidden side of statins. One of the main concerns about statins is their impact on the liver. As they are metabolized in the liver, it is believed that they can cause liver damage. Statins block the enzyme HMG-CoA reductase, reducing cholesterol production. This action can elevate liver enzymes, such as transaminases, in about 1% of patients. This increase is usually mild and does not indicate permanent damage. Levels return to normal with dose adjustment or temporary suspension. Severe cases of liver failure are extremely rare, occurring in less than 5 in 100,000 patients. Doctors monitor liver health with blood tests before and during treatment. Excessive alcohol consumption and use of other medications may increase your risk. Patients should avoid excessive alcohol and inform their doctor about other medications. Signs of trouble include jaundice, fatigue, dark urine, and pain in the upper right abdomen. If these symptoms appear, it is important to seek medical help. In patients with pre-existing liver diseases, use should be more cautious. Lower doses or alternatives such as ezetimibe may be considered. For most patients, the cardiovascular benefits outweigh the hepatic risks. With medical monitoring and regular checkups, statins are safe and effective. Neurological and heart damage. What's behind the myths? Statins are often the subject of myths about neurological and cardiac damage. In the case of neurological damage, reports of memory loss and mental confusion are extremely rare. Studies show that the effects of statins on the central nervous system are minimal and generally reversible. Memory loss may be linked to factors such as aging, stress, or neurodegenerative diseases. When associated with medication, symptoms disappear when the statin is stopped or changed. Statins do not cause serious neurological diseases, such as amyotrophic lateral sclerosis, ALS. However, in cases of pre-existing neurological conditions, symptoms may worsen. This reinforces the need for medical evaluation before treatment. As for the supposed cardiac damage, statins protect the heart. They reduce LDL cholesterol, stabilize fatty plaques, and prevent clots. Furthermore, they reduce inflammation in the vessels, reducing the risk of heart attacks and strokes. Studies indicate a reduction of up to 50% in the risk of heart attack in high-risk patients. For patients with heart failure, statins increase survival and prevent complications. Myths arise from misinterpretations of scientific studies. Correct, evidence-based information is essential. Statins, when prescribed and monitored, offer significant benefits. Discuss any concerns with healthcare professionals to ensure safe and effective use. Why do doctors trust statins anyway? Despite concerns about side effects, statins remain widely prescribed. Decades of studies prove its benefits in reducing cardiovascular risk. They reduce LDL cholesterol and reduce heart attacks, strokes, and cardiovascular deaths. In high-risk patients, statins can reduce new cardiovascular events by up to 60%. This is crucial for anyone who has already had a heart attack or stroke, as it reduces the risk of recurrence. International guidelines, such as those from the European Society of Cardiology, recommend its use. In addition to controlling cholesterol, statins stabilize plaques in the arteries. This effect reduces the risk of rupture, clots, and has anti-inflammatory action. Doctors consider the benefit-risk balance when prescribing. Serious side effects such as rhabdomyolysis are extremely rare, affecting less than 0.1%. The cardiovascular benefits, however, are significant and life-saving. Each prescription is based on the patient's individual risk. Factors such as age, family history, and diabetes are evaluated. Low-risk patients may focus solely on lifestyle changes. Regular medical monitoring guarantees safe and effective treatment. Doctors adjust doses, perform tests, and monitor possible adverse reactions. Confidence in statins comes from scientific evidence and clinical experience. When used correctly, they prevent serious events and save lives. How to use statins safely and avoid problems. Although statins are safe, some precautions can reduce risks and improve effectiveness. Regular medical monitoring is essential. Before treatment, tests evaluate cholesterol and liver function. During use, periodic tests monitor possible changes, such as an increase in liver enzymes or muscle damage. Unusual symptoms, such as persistent muscle pain, weakness, or dark urine, should be reported to your doctor. Medication adjustment may be necessary to avoid serious complications. Choosing the right statin is important. If there is intolerance to medications such as ATORVASTATIN, the doctor may suggest alternatives such as pravastatin or fluvastatin. Smaller doses may be effective and reduce the risk of adverse effects. Interactions with food and medicines should be avoided. Consuming grapefruit juice can increase statin levels in the blood. Antifungals and antibiotics can also increase the risk of toxicity. Adopting a healthy lifestyle is crucial. A balanced diet and physical exercise help control cholesterol and reduce possible side effects. Supplementing coenzyme Q10 can relieve mild muscle pain. Finally, open communication with your doctor is essential. Maintaining guided treatment allows you to enjoy the benefits of statins while minimizing the risks. Motivational final. The use of statins, like any medical treatment, can raise doubts and concerns. It is natural to question the side effects, the risks involved, and even the need for these medications. However, it is important to remember that statins are valuable tools, capable of saving lives and preventing serious complications, such as heart attacks and strokes. Science leaves no doubt. When used responsibly, under medical guidance and with adequate monitoring, statins offer benefits that far outweigh the risks. They are the result of decades of research and are recommended by experts around the world to protect heart health and prolong life. But the success of treatment does not depend solely on medications. Adopting a healthy lifestyle with a balanced diet, regular exercise, and stress control is essential to enhance results and reduce the need for higher doses. Combining these habits with the correct use of statins creates a powerful strategy for keeping cholesterol under control and your heart protected. Remember, health is an ongoing investment. Talk to your doctor, take the necessary tests, and don't make decisions based on dubious information or myths that circulate out there. Your heart deserves care, attention, and the best tools that science can offer. Don't let fear or misinformation stop you from taking care of your health. With correct information and professional guidance, you can find the right balance between treatment and quality of life. The decision to protect your heart is in your hands. Take care of yourself today to live better tomorrow.